Hey guys, this is Stephanie with Empire Physical Therapy, and today we have Kathleen, and she is with Beachside Community Acupuncture, and we've known each other for years, probably like 3 or 4 years. We're just trying to figure out like how long ago. Time just flies by, but I'm really excited. She's someone that is amazing in this field, and I can't wait for you to learn more about her and about her practice and how she got started. So, Kathleen, just introduce yourself. Tell us a little bit about yourself.
My name's Kathleen Catola, and I own Beachside Community Acupuncture. I opened this clinic specifically because in Dallas, Fort Worth, there was only one other community clinic, and that was in Fort Worth. Before this, I was in private practice, and I'd have patients who honestly couldn't afford to see me. And I was on the cheaper end at like $80 a treatment. Acupuncture and DFW can run up to $300 a treatment from what I've heard. And so the idea of a community clinic is it makes acupuncture accessible and affordable. And so for me, I just really felt drawn to bring that to the community. My background is in more pre-med, but also naturopathy. I have degrees in biology, health sciences, and nutrition, as well as my master of acupuncture and oriental medicine.
That's awesome. So, what gave you the calling to want to become an acupuncturist?
It was actually really roundabout. So, like I said, I was raised on naturopathy, never taken an aspirin in my life. We really did a lot of essential oils, diet therapy growing up, but still, for some reason, was really called to Western medicine as well. So, like I said, I was pre-med in college, debated about going to med school, finally decided that chiropractic would be a good in between. So, I started at a school that also had an acupuncture program. And I decided to apply for that program too. Had never had acupuncture before, but thought, why not add in another therapy for my future patients? And within a month, I realized I couldn't see myself practicing chiropractic. I still love referring to chiropractors, but it just wasn't for me. But I really loved acupuncture. So I ended up staying with that. And it's funny because they told us from day one that if you have any kind of Western background, acupuncture might not click. Give it a year. If it still doesn't make sense to you, then just let it be, go find something else to do. And so for me, though, even though I had that background, I thought it made sense immediately. So it is very logical. You just have to abandon really all concepts of Western medicine or even natural Western medicine to really understand diagnosis and treatment plans and that type of thing.
I totally agree. I mean, I've been on a similar path, but I grew up being in Western medicine, and when Western medicine failed me, when I had some like health issues, and I was like, I'm done. Like, you're giving me the same answers. Nothing that you're saying makes sense. You're telling me that diet doesn't help, and I know from my background that it does. I just need to dive into it a little bit more. And so then that's how I came into, really, I had no clue what naturopathic medicine is, which, there's a naturopath doctor that I refer to people all the time in North Carolina. They don't really have a lot of rights here in Texas. And just learning more about them, like as I went through my own journey of just learning more. And I agree. I mean, like when you start going down this path of more like natural medicine, it makes sense. The Western medicine doesn't make sense, and all the testing and everything they do, they're all like symptoms. They don't really get down to like, well, why is this happening? And that's a big problem, and it's costing healthcare a lot, and it's a lot of frustration for a lot of people too, because they aren't getting answers.
Yeah, well, what I tell patients for the most part, Western medicine is really great, like you mentioned, for the amount of testing they can do.
Yes.
And so you can get tests done that gives you just more options and, listen to the doctor's options. But if you don't like those, then that's a good jumping off point that you can, reach out to you or me or whoever else and just have a little bit more information. And of course, Western medicine is always good for emergency medicine. So obviously,
Absolutely.
don't
Oh
ever
my
come to
gosh.
us for.
Hands down, that's when that's when our system is amazing, because
Yeah.
I mean, there's some doctors out there that put people back together from emergency things that I'm just like, they are magicians. But overall, I mean, with most of the conditions that we get, whether it's
Chronic.
an injury
Yeah.
or there's a health condition, a lot of these things can be treated more naturally, and you'll get better outcomes and you'll feel better. And the answers that you get and understanding, like that's the big thing. I think that's the difference between like what you do and what we do, is really explaining to the patient why, and not just being in and out in a 5-minute conversation and saying, this is the test and this is what we have to do, but why. And a lot of times we encourage people, go see your doctor, bring your information to us, and let's sit down and let's have a conversation. to see if this really does make sense based on what we know and based on what you're being told.
Yep. And then also just working with the body more so than against it. A lot of times with traditional Western medicine, you're kind of overriding something in the body, which again is necessary in a lot of circumstances. But if you're working with something chronic or something that, the standard treatments really aren't working very well, you want to get back to, okay, what's the body trying to do? Why is it doing it this way instead? How can we help it, get back on track?
Yeah, no, that's awesome. So tell us a little bit more about how your practice is set up, because I know it's a little bit different. Yeah, more about the community.
Yeah, so traditional or acupuncture in America is traditionally practiced in what we call private practice. So you go in, talk to an acupuncturist for a bit, that kind of varies, and then you're in a little treatment room by yourself, usually like on a massage table. And a lot of times you get like 20 or 30 minutes on that table, maybe up to an hour or so. With the community model, it's a little different. So we do a little modified. I still like to really talk to patients versus true community clinics. A lot of times you just walk in, talk for a few, couple minutes, just really get the gist of your chief concern, and then that's it. So we have it modified that when you come in, we spend 15 to 25 minutes talking the first time, really get a good idea of what's going on in the body, discussing all aspects of health and Chinese medicine. Everything's connected. The treatment is what's the really different part. We have one big community treatment room with recliners. Other people come and go for their treatments too, but everybody keeps to themselves. So most people take a nap. I have patients who will bring a book or earphones to listen to a podcast or meditation or whatever else. And I tell patients to stay the full hour if they've got that time. If they need to cut it shorter, we can cut it shorter. But otherwise, it's a good long break just from day-to-day life. And so that's really the community model, is that people are in a treatment room together. Obviously, with COVID, we had to make a few changes. So we see fewer patients per hour, just so people aren't on top of each other. And then we also have our chairs continue to be spaced out more than 6 feet. But otherwise, again, so it's more of a healing atmosphere that other people, even though they're coming in for different things, you might not know them, you just know that other people are healing at the same time. And then one of the biggest draws of community acupuncture is the pricing. As I mentioned, private practice tends to be very expensive. The community model usually makes it a lot more affordable. We do a sliding scale, 45 to 65 for the first appointment, and then 30 to 50 for follow-ups. And sliding scale means you pay what you can afford, and we just go by the honor system. So we have patients who the upper price is no big deal. They pay that all the time. We have patients who are truly scraping together money to see us at the lower ends, even once a month. So we see a wide variety of people. We treat people from all walks of life. And the final benefit of community acupuncture is that people could come in together to get treated together. So each patient needs their own appointment. But if, say, like a husband and wife or friends or family members wanted to book back-to-back appointments, they could be healing in the treatment room at the same time, which again, some patients like to do as either a date night or something to do that's a little different with their friends or family.
Tell us a little bit about like who you treat, like your typical client, what you treat, those kind of things.
Yeah, I'd say that we definitely see pain the most out of anything. So some people come to us as a last resort, that they've already tried all the Western injections and drugs or chiropractic or massage. Some people just right off the bat know that acupuncture works well for them, so they come to us as a first resort. Other than that, though, acupuncture treats really almost everything. It's part of Chinese medicine, which is an entire system of medicine. And so we get random things come in that, again, they have no idea what's going on. Western doctors can't tell them what's going on. More commonly, though, anything along the emotional scale, so anxiety, stress, depression, especially the last 2 years. And then fertility is another thing we do a lot with too. So patients trying to conceive naturally or going through medical interventions like IUI or IVF. Outside of that, though, I mean, you name it, insomnia, digestive issues, everything.
That's awesome. So what do your clients like love as far as like what you guys do? Like what are their things that they're like, oh, I love this piece of it?
Yeah. So a few things. A lot of our reviews are just how much we listen, which sounds, to me, it sounds awful that that's not every practitioner, but we do like to really listen to everything going on, get a good feel of, even outside influences, like, okay, how is your family dynamic affecting your health right now? How is, the weather, anything else? And just try to look for patterns in their symptoms, really. Outside of that, though, our clinic is beach themed. We are Beachside Community Acupuncture. So, especially in winter in North Texas, it feels like a little vacation. So, we keep the room warm. Again, once you walk in, it's just tropical everything everywhere. And during the treatment, you're listening to ocean waves on repeat. So, a lot of patients just, again, like that feeling of a vacation. Acupuncture puts the body into the parasympathetic or rest and digest state. So, most people feel relaxed regardless, but that's just an added element that makes it feel a little even more relaxing.
That's awesome. No, I get it. I feel like that's the biggest complaint that I see in healthcare is that just people don't listen. They don't sit down and they don't take the time to kind of hear their story. And a lot of
Yeah.
times that is healing in itself. And people need to get that out. And then just hearing like what you said, like the patterns of like where is this coming from? There's so many different avenues that could be creating some of their issues. And definitely, I always say, from a pain perspective, it may not be mechanical. There can be an emotional component that needs to be addressed. There can be a stress component that needs to be addressed. They kind of go hand in hand. There can be an autoimmune component. There's so many things that can create pain, and you've got to really get to the source. Otherwise, you're going to be frustrated,
Yeah.
and that takes time. That's something that takes a conversation. Can't be done in 5 minutes, which is
Yeah, I always try to tell patients that it's a journey as far as health and
yes.
getting back to great health. And obviously, all of us want to be just back to what we were doing immediately. But again, some of it takes time. Like, we do have patients who bounce back pretty quickly, but a lot of times it's like peeling off layers. So, okay, this is
Absolutely.
better, but there's this going on, and going
Yeah,
from there.
that's exactly right. It didn't take you overnight to get to this point. It took you years to get to this point. And sometimes,
Yeah.
it is. It's like peeling back an onion. Like one thing leads to another, which leads to another. But it's getting down to the source, the true source of what it is. And there's a lot of components that go to that. So, what's one thing that you would say that separates you from other acupuncturists?
Well, so a couple things. As I mentioned a few times, we're the only community clinic in Dallas, which is kind of crazy, honestly. So if you look up any major city, usually there's at least one, if not two or three community clinics. And again, it's meant to serve maybe a different population than private practice would, or maybe the same population that just likes the model better. And so that's the biggest differentiating factor. And then otherwise, again, there aren't any beach themed clinics either. So in North Dallas, you don't come across very much of that. And so that's another thing that usually kind of stands out to people like, oh, well, why is this way? So
Anything else that you'd like to add that you want other people to kind of know about your office and about you?
again, just we really focus in on the whole person, and that's Chinese medicine for the most part, even holistic health usually are focused on the whole person. Again, though, not every acupuncturist does that. Some really are just, okay, what hurts? Let's figure that out, and that's it. We like to really look at everything. And again, in Chinese medicine, we're looking at a very, very different perspective than Western medicine. So sometimes it's that you already have your, team of health professionals that are Western minded, but still holistic. And then Chinese medicine will just bring that extra different view of things that can easily fit in with everything else. We'll have patients say, I'm already seeing a chiropractor. Am I already seeing a massage therapist? Can I do this at the same time? And from my perspective, I think everything is great. So everything works well together. We've had chiropractors or massage therapists tell our patients that they're able to maybe adjust something that was too tight before, or massage in more deeply than they were before. And often the progress that they make with those other practitioners gets sustained for longer periods of time when they're doing acupuncture as well. So I think that that's a big thing that a lot of people are really concerned about. Oh, I shouldn't do too much at once. If you wanted to experiment and do one at a time just to see what's giving you the most relief, fine. But for me personally, if I have something wrong, I want to attack it with everything I know. And so that's usually what I tell people, that you're more than welcome to, take herbs and see your massage therapist and see your physical therapist and get acupuncture. All of it's just going to help in the long run. So I, get that fairly often. And I like that people would, I would like that people would know that it's okay to, again, have a whole team of people watching out for you, because that's kind of the ideal anyway.
It is, because everyone does a little bit, or can see it, your body in a little bit of a different way. And I always tell people sometimes, like even when we switch therapists or I send them to someone else, it's more of, it's like reading your paper that you wrote. Like you can read it and read it and read it. You don't see any of the mistakes on it because you've seen it so many times, but you have someone else that looks at it in a different way. Like, oh, there's a mistake here. There's a mistake here. Oh, we can look at this way, especially for like those complicated cases, because it's complicated for a reason.
Yeah.
and it's not an easy fix, and sometimes it needs multiple people to really help in all the different aspects that's going on.
Well, I think it's more of a cultural thing in America also, that we think, okay, just go to a doctor and then after that, maybe to each specialist, and you get referrals each time. And a lot of times they're not really communicating or talking with each other as much, which again is a generalization, but for the most part, that's what we see, what our patients tell us. And so it is nice if you could just, gather information from everybody treating you, including Western doctors, and have like a really comprehensive picture that you understand as a patient too. That's a big thing that we try to really harp on, that it's worth being mindful of your body, being aware of changes as they're happening. Each time someone comes in, we spend 5 or 10 minutes just talking about what's changed, and it might be even slight, and it might be completely unrelated to your chief concern. So if we're treating knee pain but your sleep's getting better, guess what, that's when the body's going to heal itself anyway, so that's an improvement.
Piece of it, like when that's one of the things, that when your sleep is off, there's something else going on in the body that needs to be addressed, because that's just like a symptom of other things that are happening. So I think in the healthcare, it's just our insurance, the way we have it set up, it's just gotten worse and worse and worse. Because I think we used to go to a doctor and spend time with them. You'd have their main family doctor, and it's like you went to them and he knew everything about you. We don't have that anymore. And I think the system has made it where, oh no, go see a specialist because we can get another copay or another visit, because now I know you have back pain, but you also have knee pain, and I'm going to send you to the knee pain specialist because I'm only a back pain person. I'm like, they're probably connected.
Yeah.
And I always tell people, like, what the side of the pain is often not where the source of the problem is coming from.
Yeah.
And so you can't just look at where that is.
I had a patient once with pain right at the top of her trap here. She went from a shoulder specialist to a neck specialist back to a shoulder specialist because they were arguing over where it was. I'm like, that's crazy.
Crazy. I'm like, oh my gosh. And the neck and the shoulder is so connected. You can't look at the shoulder without addressing the neck and the thoracic spine. You'll miss it. I mean, we've had people with like rotator cuff tears and surgery scheduled, or did surgery, and it wasn't a rotator cuff that was a problem. It was a neck problem or a thoracic spine problem. And so you really need to make sure that you have your team of people surrounding you to really help you make the best decision for your health. And that's where I think you come into play, and we come into play, is really helping people navigate the system a little bit better.
Yeah,
kind of
it is confusing for someone who doesn't really know about health. And so that's something that, again, we try to help with a bit, and, give referrals to people like you and other people as well. And, just really try to help them along on that health journey instead of just being isolated, like, oh, we're just doing acupuncture and that's it.
Yeah, absolutely. Yeah. So how can people find you?
So easiest is on our website, so beachsideacupuncture.com. Or like I said, even if you remember from this talk that we're a beach-themed acupuncture clinic, you'll find us, or community clinic. We're the only one in Dallas. But beachsideacupuncture.com is our official website. We have a blog that we update every month. We have lots of information about acupuncture, frequently asked questions, and so on. So that's just tons of information. We're also on social media. Our handle is @beachcomacu, which is basically a shortened version of our name, and that's Pinterest, Facebook, Twitter, Instagram, and so on. And of course, we also are available by phone, and you'll see our phone number on our website.
Awesome. Well, thank you so much. It was so much fun hearing your story and catching up.
Thanks. Thanks for having me.